Hey everybody, Dr. Chris Phillips here with our Tuesday 12 Minutes to Health. Thank you for joining us. Those of you inside the clinics, thank you for showing up tonight and coming to learn just a little bit more on how to be healthier, how to live a healthier lifestyle. And tonight, well, we're going to talk about chiropractic care and how to get out of pain and stay out of pain and what the research says on that. So thank you guys for being there. Take advantage of being there. If you have questions at the end of this, ask the doctors that are there. Ask Dr. Stevens, ask Dr. Travis, and get all the answers you can. Soak up all that information because education and understanding this is very important to you being healthy, and it's actually one of the benefits of seeing a chiropractor, which you'll see in tonight's study. So thank you guys for being with us. Those of you watching on Facebook, thank you as always for tuning in, and reach out to us. Get your questions answered and get into the office. Join us on Tuesday nights. Have some of our healthy snacks and refreshments and get the answers to your questions. So I'm going to get started with tonight. As always, in our 12 Minutes to Health, we do everything we can to provide you with the best research that's out there. Not the case studies, not our opinions, but the randomized controlled trials and the reviews of the randomized controlled trials that create good, solid research. That way you're getting just not my opinion, not Dr. Stevens, Dr. Travis's opinion, but the actual facts that are out there, which allows us to give you an evidence-based approach to your health and your health care. So let's get started with tonight's study. Like I said, it's dealing with chiropractic care, and it's done by David Chapman Smith. It's called The Chiropractic Profession, Basic Facts, Independent Evaluations, and Common Questions Answered. So what they do is they go into the research, and I love the chiropractic research, right? Because I'm a chiropractor, and it helps prove that what I'm doing is the right thing for patients. But it's continuing to grow, and it's just showing more and more how motion and keeping proper motion in your joints is eliminating pain, is eliminating dysfunction and arthritis and all that kind of stuff. And it's just helping you live a healthier, better quality of life. So this study goes on to do the same thing. This is a review of all the different randomized controlled trials out there, and these are the things they looked at. So one of the first things that they looked at is they wanted to see what do most people go see a chiropractor for? Like what are people seeking out chiropractic care for? So what they found is a majority, the 60% of people who seek out chiropractic care are doing so for back pain, low back pain, mid back, neck pain, those types of things. That's what most people would think to go to a chiropractor for. And it's highly effective for those symptoms that you're having, which we'll get into in a second. But that's what 60% of people seek out chiropractic care for. The next 20% of people seek out chiropractic care for other joint pains. So they look at shoulders, knees, hips, elbows, ankles, just your other joints and pain that you may be having in there. And this is actually one of the big reasons that I saw a chiropractor as much as I did through high school and college when I was wrestling, is for different aches and pains. And it actually helped me push off some surgeries that I tore my body up, but I was able to keep wrestling with a bump shoulder or bump knee here or there thanks to my chiropractor throughout high school and college. So that one kind of hits home to me. I was part of that 20% there for a while. The next 10% of people that see a chiropractor do so for headaches. And these are migraines, these are tension headaches, any type of headache that you can think of. And these are some of my favorite patients personally that we get to see because I never realized how debilitating these headaches are, right? I had your occasional headache, either the self-imposed headaches, right? Or I had a concussion here or there that caused me a headache, but nothing that really stuck around. And I was always seeing a chiropractor, which makes sense too, that they didn't stick around. But some of these patients it's so rewarding for me as the doctor to help these people get back to living their life, because they really are not living life when they have constant migraines. Patients that come in and they get headaches so bad that they throw up, or they have to just lay down and just neglect the rest of life because the headache is that bad that they've got to be in a dark room until this thing passes. And to just see everything come back for them and their whole demeanor change as headaches start going away, as they start getting adjusted. It's really cool. It's life-changing for the patients, and it's really cool for us to see. And it's so effective, and it happens so quickly for these patients that it's really fun to watch. The last 10% I didn't put up on the slide tonight, and that's because these patients reach out to us because they heard chiropractic can help with X, right? Whether it's asthma or getting pregnant, women that have been to fertility doctors and different things like that, that had trouble getting pregnant. They saw a chiropractor and then they were able to get pregnant. Allergies. I mentioned the asthma. There's all kinds of acid reflux. There's tons of stuff out there. And I've had these patients myself. I was this patient. This is the main reason I got into chiropractic care, is because when I was 10 and started seeing a chiropractor, my asthma cleared up. And I asked my doctor about it, my medical doctor, and he goes, sometimes asthma just goes away. Well, that wasn't a very good answer for me. I didn't like that very much. It didn't. I needed more, right? That's just my personality type. So I started asking my chiropractor, and he said, well, we got things moving correctly. And, sometimes structure can equal function. And that was kind of the answer that most chiropractors had. That, or my nerves were trapped and he untrapped them, which, is not a good answer for me either. But the reason I didn't put those things on the slide, the inability to get pregnant, the asthma, the allergies, is because we don't have the randomized controlled trials for them. Right? So we have case studies. I'm a case study, right? If my chiropractor could say to someone, well, I had this kid that I started adjusting him and his asthma went away. That was the only thing that changed in my life, was the adjustment. Do I contribute it to that? Yeah, I do. Is that proven? No, it's not. It's a case study. And I see stuff like that all the time. But the difference is you've got to be honest with patients, right? That it's not proven yet. We haven't done the randomized control trial of the adjustment versus inhaler for asthma. Right? Have I had kids that I've adjusted and their asthma has started to clear up? Yeah, all the time. But I can't tell patients, come in, I'll get rid of your asthma, because I don't know that. We haven't proven it yet. We do have case studies, and we have those things that happen, and I can talk about that, but it's not randomized control trials, so I didn't include it here for you. But the neck pain, the back pain, the headaches, the joint pain, that stuff is proven through randomized control trials, and chiropractic is highly effective for those types of things. The other thing that this study went on to look at is, what else do chiropractors provide their patients that is making this experience so good? Because chiropractors have a very high rating with patients. Like, patients love their chiropractors, or so they dug in, like, why else do they love them so much? And one of the things they found is that chiropractors are very good at educating and empowering patients to take care of themselves, teaching them about health. This picture that you see on the screen here, this is from our Tuesday 12 Minutes to Health. This is a couple weeks ago. But this is one of the things we do. We are constantly educating people, whether it's through Facebook and social media, or people just in the office watching these talks, getting their questions answered by the doctor. We have research everywhere in the office because that's how we base our healthcare. So the education and the empowerment to just let patients know that, it's proven you can live a healthier lifestyle goes a long way in chiropractic care. So those of you in there tonight, make sure you're getting your questions answered and taking care of the education and taking advantage of the education side of chiropractic tonight. So the next thing that they found is that the research continues to mount in the favor of chiropractic when it's compared to usual medical care, physical therapy modalities, opioids, surgeries. Chiropractic care keeps coming out as a better option to take care of these aches and pains, especially when it comes to back pain, neck pain, headaches, things of that nature. So the research continues to mount, and it's just proving itself to be safe, effective, and cost-effective, right? This picture here is actually one of the flyers that we hand out on a monthly basis. This is a review of different literature that Dr. Chestnut puts together for all of our patients, and we send this flyer out to everybody so that they understand the research and know that they're doing the right thing for their body and that we're doing the right thing for them. So research is another reason that chiropractic care is doing as well and growing like it is. The last thing that they looked at in this study was money, right? Is it cost effective? Because that's one of the fears that's out there. I hear it from people all the time as well. I can't go see the chiropractor. Yeah, I'm hurting, but it's too expensive. Well, they started looking at everything else that takes care of back pain, right? And when they looked at surgeries, they looked at medicines and how long they last and how often you need them. And the same thing with chiropractic care. They found that it was highly cost effective in this study. And that was the terminology. That's a direct quote. Highly cost effective is what this chiropractic care turns out to be. So not only is it safe, not only is it the most effective, it's highly cost effective. And it was funny because I was I was doing the research, going through this stuff, and I'm highlighting, and I'm like, I know all this stuff, right? Because I look at it all the time. But I had a thought in my head. I was like, what's back surgery cost now? Because I know it's expensive. Well, sure enough, Facebook read my mind, and they sent an article across as I turned on my phone later that evening, and it showed the most expensive medical procedures in the United States. So I just went and scrolled down till I hit back surgery, and they had lumbar spine surgery on there was $75,000. That's a lot of money. And knowing the research, I know that lumbar spine surgery is about 50-50 in effectiveness. Sometimes it works, sometimes it doesn't. It's about 50% of the time. And most of those, even when they are effective or not, they have to have another surgery later in life because it stops that segment from moving when you get, and that's the number one reason it's not effective, right? Is because we need motion. That's why chiropractic works, is because it creates motion. There's no drug or surgery or modality that will ever create motion in the joints in your spine. That's what the adjustment does, and that's why it's so effective. So you look at this, and you got a $75,000 charge for your lumbar surgery. Then the levels above and below stop moving because that's how the body works. So they got to go back in. That's another 75 grand if it hasn't gone up 10, 12 years from now when you need it again, if you get that far. It's a crazy cycle that you get into, this whole medical cycle. And that's why this study went on to say, chiropractic care, this study and many others, is safe, effective, and highly cost effective. So those are the big points from this study. And that's, those are some of the things that I know I face questions all the time as a chiropractor about, well, one, does it actually work? Two, is it safe, right? And then three, it's going to cost me a lot, right? And the answers are yes, it's safe, yes, it works, and no, it's not going to cost you a lot. But the cost is relative, of course, to everything. But that's why we do our first visit the way we do it. And just the $39 donation from someone goes to Wounded Warriors right now, and it's to eliminate that. It costs too much thought. I don't want you guys to have to think about that. If you're in pain, you need to think about getting out of pain. What's the best way I can get out of pain? And your answer is chiropractic care. So get in and come see us. We'll take the x-rays, we'll do the assessments, the exams, the consultations, everything we need to do to know exactly what's causing your pain, what is or isn't moving, and how do we get it moving correctly again? How do we get rid of your pain, your headaches, your symptoms, whatever it may be? And as a bonus, you get all the education stuff that we talked about earlier. You get to know how to eat better, how to move better, and how to think better. And that's how you live a healthier lifestyle at the end of the day. So if you've been suffering with pain or headaches or anything that we've talked about tonight, now is the time. Start to take care of yourself. Let's get you in. Let's see what it's going to take. We'll go over everything with you too. We'll show you exactly what it's going to take us to get you better, how long it's going to take, what it's going to cost. If you have insurance, we accept that, and we'll go over that with you and show you what the insurance covers and what you have to cover. But most importantly, we're going to help you feel better, and we're going to keep you feeling better. So give us a call today. Get all your questions answered. Like I always say, thank you guys so much for joining us. I really appreciate it. And we'll see you next Tuesday when we talk to you about probiotics and the benefits of probiotics towards your health. So thanks, guys. I'll see you next Tuesday.